I'm Dr. Guantwa, and today we are going to talk about malaria. Malaria is a disease that kills many people every day, especially children less than 5 years old. In fact, one child in Africa dies every minute from malaria. It is one of the major causes of death in Africa. I know you have heard about malaria, but would you like to understand it better? Do you want to know what you can do to protect yourself and your family from this deadly disease? If you become infected with malaria, you can be treated with medicine. It is important to get medical care early if you suspect you or your family member may have malaria, because it can quickly make you very sick. You will be given medicine to make you better. The healthcare provider will tell you how to take the medicine, and you should follow those instructions exactly for it to work properly. Sometimes the medicine doesn't work and another medicine needs to be tried. Malaria can be difficult to treat at times. Wouldn't it be wonderful to avoid getting malaria so you wouldn't get sick and have to get medical care and pay for it? Did you know that there are several things you can do to reduce the risk of getting malaria? Let's talk about some things you can do to reduce the risk of you or your family member getting malaria. There are a few things you need to know about malaria to help understand how to prevent it. A very small living thing called a parasite causes malaria. The malaria parasite enters your body through a mosquito bite. The parasite needs both mosquitoes and humans to live, and it is passed back and forth between mosquitoes and humans by mosquito bites. When a mosquito containing the malaria parasite bites you, it injects a small amount of saliva into your body that contains the parasite. The parasite goes to our liver where it multiplies for a week or two. You won't know it is in you during this time because you feel normal. About 2 weeks or longer after the bite, however, the parasite leaves the liver and enter the blood. The feeling of sickness comes when parasites emerge from the red blood cells, and this repeats every 48 to 72 hours. If another mosquito bites you when you are sick, it sucks in the blood containing the parasite, and this mosquito becomes infected with malaria. This mosquito can then spread the malaria to another person when it bites them. Do you see how the malaria parasite goes back and forth between mosquitoes and humans? The parasite lives in both mosquitoes and humans and needs both to survive. The malaria parasite doesn't live in any other animals, including apes, reptiles, birds, and rodents. Most mosquitoes don't have the malaria parasite in them, just the ones that have bitten a human who has malaria. However, you have no way of knowing which mosquitoes have the malaria parasite and which don't, so you need to protect yourself from all mosquitoes so you don't get malaria. Malaria causes many different symptoms. These symptoms start about a week after the bite that put the parasite in the body. People with malaria can get fever that comes and goes. It can be a very high fever with shakes, but it is not always so. Chills and sweating, nausea and vomiting, headaches, body aches, backache, and joint pains may also occur. Confusion, incoherence, agitation, and even chest pain or abdominal pain can be present. Sometimes people become unresponsive. Malaria can have such a high variety of symptoms that the disease is often called the great imitator of other diseases. Many times, a doctor can tell what disease is making someone ill by asking what symptoms are present. This is not the case with malaria. It is difficult to know if a patient has malaria just from the symptoms. The best way to know is to take a sample of blood from the patient and use a special test to tell if the parasites are in the blood. This is why it is important to get medical care in situations where malaria is suspected, such as with fever, shakes, chills, body aches, headache, decreased alertness, agitation, or other symptoms where you suspect malaria. Once the healthcare provider has determined that the patient has malaria, medicine is given to treat the disease. Malaria can become serious very quickly, so it is important to go to the clinic and start treatment early before the disease becomes serious or even life-threatening. None of us want to get sick with malaria, do we? It is well worth some effort to avoid getting such a bad disease with the risk of severe illness and death. The most effective thing you can do is to prevent the mosquitoes that carry the malaria parasite from biting you. The mosquito that carries the malaria parasite comes out after dusk and goes into hiding again at dawn. It generally bites humans for its blood meal between 11 p.m. and 2 a.m., but it can bite at other times of night as well. People are usually inside their homes during these times, and the mosquito most often bites people while they sleep in the night. You can prevent yourself and your family from getting bit by blocking the mosquitoes from biting you, killing the mosquitoes, or preventing the mosquitoes from breeding. First, let's talk about blocking the mosquitoes from biting you. As I mentioned, this usually occurs when you are in your homes, in bed, asleep. One thing to do is to keep the doors of your house closed at night. This prevents mosquitoes from flying into the house at night. Mosquitoes can sense the heat and smells of your body and breath, and they can come after you for their blood meal when they are hungry. A closed door keeps them out. Of course, they will also try to come in through the windows of your home. Glass windows can block them if the windows are closed, but often we want the pleasant, cool night air to come in our house, so we don't want to close windows. In this situation, a screen over the window opening can keep the mosquitoes from getting in your home, but still let in a breeze. Check the screens in your home to make sure they are not torn or open at the edges where the mosquitoes can get through. Screens on the windows are very effective at keeping mosquitoes out of the home, and they are well worth the cost and effort of installing them if you don't have them already. It is better to install screens than to have your family members sick. Many houses have open eaves. This is a space between the roof and the wall, and mosquitoes can easily get into the house through this space. Putting screening in each of the eave openings can keep mosquitoes from entering these openings. Another option is to put a ceiling in your home so the eaves are separated from the living and sleeping areas of the house. This can be done with a solid ceiling or a large piece of netting tucked to the roof beams. Now the outside of the home is protected with a closed door, screens in the windows, screened or blocked eaves, or a ceiling. This means mosquitoes are much less likely to get into the house at night and transmit malaria with a bite. Walk around your home to see if there are spots where mosquitoes can get in, and block or screen these openings so they can't enter your home. However, some mosquitoes may already be hiding in your home or still able to get in when the door is opened. You need to protect yourself and your family from these mosquitoes while you sleep. Netting over your bed is a very good way to protect yourself from mosquito bites while you sleep. Bed netting can be used instead of protecting the outside of the house with a closed door and screens. But you can imagine that it is even better when both bed netting and home protection are used together. Netting can be hung from the ceiling or from a frame over the bed. Make sure the net is large enough to cover the entire bed and long enough to hang over the edges of the bed. This prevents the mosquitoes from getting to you under the edges of the net. Be careful to avoid rough handling of the net and protect it by tying it up during the day when it is not being used. If there are any tears in the netting, repair them with a needle and thread as soon as they appear so they don't enlarge. Netting can be treated with an insecticide to make it even more effective. Using an insecticide-treated net is over twice as effective at preventing malaria as using an untreated net. One of the best ways you can protect yourself and your family from malaria is by using insecticide-treated netting. You can make insecticide-treated nets yourself by putting untreated netting in a bucket filled with liquid containing a special insecticide. Nets treated this way will kill mosquitoes that land on them if the treatment is done properly. However, treating bed netting with insecticide this way doesn't last long, and the netting needs to be retreated at least every 6 months. A better way is to use long-lasting insecticide-treated netting. This is called LLIN for short. LLIN is available for purchase but sometimes can be obtained through government programs or non-governmental organizations. These nets will have a label indicating that they have been specially treated with an insecticide that will last for years. The insecticide in these nets usually lasts for at least 3 years before it loses strength. A long-lasting insecticide-treated net is generally a color such as blue rather than white, so you know it has been treated. Long-lasting insecticide-treated nets gradually lose their ability to kill mosquitoes with each washing. Therefore, wash them as little as possible. Don't wash them more than 5 times per year, and use only mild soap while washing to avoid removing the special insecticide in the net. Hang the net to dry in the shade after washing, because sun can cause the insecticide to lose strength as well. Long-lasting insecticide-treated nets will have a date marked on the package indicating when they will lose their strength. Mosquitoes landing on the net after this date may no longer be killed. Use a marker to record the expiration date on the net so that you will know when to replace it. LLINs are very effective at preventing you from getting malaria for several reasons. First, the netting blocks the mosquito from biting you while you are sleeping. Also, the insecticide treatment in the net kills the mosquitoes when they land on the net. Many of the mosquitoes in your home can be killed this way, especially if everyone in your family is using LLINs. You are also helping your community by using insecticide-treated nets and long-lasting insecticide-treated nets. Your nets are killing mosquitoes every day, so you are reducing the number of mosquitoes in your community. The more people in your community that use insecticide-treated nets, the more mosquitoes are killed in the community. Remember that malaria is passed from one person to the next by the mosquito, so reducing the numbers of mosquitoes in the community will reduce malaria. Mosquitoes also transmit several other diseases, including dengue, yellow fever, and chikungunya. So protecting yourself from mosquitoes will also help keep you or your family from getting these other diseases as well. The chemicals used for the insecticide-treated nets and the long-lasting insecticide-treated nets, or LLINs, are very safe for humans, and there need be no health concerns about using the insecticide-treated nets and the LLIN in your home. Overall, insecticide-treated netting has been found to be the most effective way of preventing malaria for the least cost, and LLINs are much cheaper to use than self-treated insecticide-treated nets. Another option for killing mosquitoes in the home is to use a spray form of insecticide. The insecticide spray can be used to spray the air inside the house to kill mosquitoes waiting there to bite you at night. You should be careful to not be in the house right after spraying it with insecticide for health reasons. These sprays can be harmful if they are breathed, so the best time is to spray the inside of the house in the afternoon or in the evening. You and your family should remain outside for several hours after spraying to reduce the health risks of breathing the spray. Spray insecticide will kill some of the mosquitoes that would otherwise bite you later at night. Most sprays kill only when the spray touches the mosquito. The mosquitoes may survive if they are hidden from the spray, such as when they are on the ceiling, under furniture, or in the folds of fabric. Spraying with standard insecticide spray is less effective than using insecticide-treated nets and long-lasting insecticide-treated nets, and has some health risks if it is breathed or if the spray gets on our skin, food, or the items we eat with. It is far safer and much more effective to use long-lasting insecticide-treated nets instead of room insecticide sprays. It is also a lot easier. There are some other things you can do as well to reduce risk of getting malaria by killing mosquitoes in your home. Indoor residual spraying, also called IRS, is an effective way to kill mosquitoes in your home. IRS works by using special insecticide sprays that kill mosquitoes not only by directly spraying them, but also by leaving the insecticide behind on the sprayed surface. When walls and ceilings, as well as the underside of furniture, back of the doors, and porches are sprayed with these residual insecticidal sprays, mosquitoes landing on these areas even weeks after spraying will be killed. This is an effective way to kill mosquitoes in your house, but only people with special training can apply this type of spray. Another thing you can do to prevent mosquito bites is to cover your skin. You can wear clothing that covers as much of your body as possible in the evening and night when the mosquitoes are looking for a blood meal. For example, you can wear long skirts, long-sleeved shirts, socks, trousers or pants, and a scarf to keep the mosquitoes from landing on your skin. Another way to protect your skin from bites is to use an insect repellent spray or lotion containing DEET. DEET is a very effective insect repellent you put directly on your skin to repel the mosquitoes. It needs to be reapplied every few hours to maintain effectiveness. Mosquitoes need stagnant water in which to breed. Females lay eggs in the water that hatch into small larvae and later mature into adult mosquitoes that can bite us and give us malaria. Mosquitoes only fly within about 2 kilometers of where they were born, so you can help reduce the number of mosquitoes in your neighborhood by eliminating their breeding spots of stagnant water. They cannot breed in flowing water, but any non-flowing water can breed mosquitoes if it is present for more than 1 week. Even small collection of water in a can, bucket, or paddle can be a location where mosquitoes breed. Go around your house and neighborhood and look for places where water can collect or it has collected. Dump out buckets, old tires, trash, and other items that have collected water and turn them over or get rid of them so they won't collect water with the next rain. Fill in persistent puddles with some soil and see where else you can locate water that has collected so it can be eliminated. This will reduce the number of mosquitoes in your neighborhood and your chances of getting bitten. Malaria is one of the major killers of people in our country, and it is especially dangerous for young children. Protect your family by closing the door at night, using screens on the windows and eaves, using long-lasting insecticide-treated nets on the beds for everyone in your home, and work with your neighbors to eliminate mosquito breeding areas in your neighborhood. These and other measures can be very effective ways for you, your family, and your community to reduce the threat of malaria.